Okay, so we did our project on renal disease. This is going to be by Colt O'Brien, Paul Banks, and Raymond Kumar.
Okay. Sorry, Cole. Aren't you going to blow it up again?
Oh, yeah, I can do that.
Yeah.
Okay, so these are some of the learning objectives. At the end of this presentation, you're going to be able to understand the prevalence of renal disease, identify risk factors and symptoms, as well as preventative measures for renal disease. You're also going to be able to identify health resources available within the Stockton community and how they can benefit you. And you also understand some of Healthy People's 2020 goals in relation to kidney disease.
All right, I'm up. So good morning, classmates. My name is Paul, and I'll be discussing the prevalence of chronic kidney disease today and how it impacts our community. Kidney disease is a global problem. According to the National Kidney Foundation, kidney disease affects 10% of our population worldwide. In 2020, the Global Burden of Disease study determined that kidney disease is ranked the 27th leading cause of death around the world. Next slide. Here in the USA, kidney disease is problematic concern, affecting 15% of the adults within the United States. Statistically, that would be every 1 in 7 adults. One interesting fact that I found out concerning that is concerning is that 9 out of 10 people are unaware that they have kidney disease, and 2 out of 5 people don't know that they have severe kidney disease. Next slide. So here in San Joaquin County, out of 100 people, 25% affect. So that's literally 25 people that have kidney disease and don't even realize that they have it. Next slide. Here is some data that I found from off of the CDC website. This breaks it down by age and race and gender. So I found that people who are 65 and older are they most commonly can get kidney disease, and according to this data, women are more likely to develop kidney disease compared to men. Recently found. Sorry. Next slide. Go ahead.
This is just a slide identifying some risk factors and symptoms in relation to kidney disease. Kidney disease can be a secondary problem to primary diseases, or it could be a primary disease in and of itself. Some of the risk factors include if you have diabetes, if you have hypertension or high blood pressure, if you have heart disease, if you have a family history of renal disease, you're more likely to develop it, as well as obesity. For symptoms, some of the symptoms, or if you do have chronic kidney disease, you may not even have any symptoms, and that relates back to not knowing or how many people don't know that they have kidney disease. The best way to figure out if you do have it is say, for example, if you do have risk factors for kidney disease, you're going to want to go ahead to your doctor, get blood and urine tests done. They're going to be checking your creatinine level, your glomerular filtration rate, checking your urine for any protein found in the urine or any of these tests that could be done to see if you do have it. And another thing or symptom related to it is that it's going to tend to get worse over time. So you may not get symptoms until this disease has progressed very far along. And that's why it's best to get these tests done to see if you have or may be at risk of getting it. And then chronic kidney disease can also lead to renal failure. Preventative measures, you're going to want to manage hypertension if you have hypertension. If you're diabetic, you want to make sure that you're controlling your blood sugar levels. Diet and exercise are extremely important for everybody, and especially if you're at risk or if you had any of the associated diseases with kidney disease. You're also going to want to get tested regularly if you are at risk. Go to your doctor, talk to them about it. If you do smoke, smoking cessation is a good idea. Smoking can cause a variety of diseases, and chronic kidney disease is one of them. And then if you have been diagnosed with chronic kidney disease, you're going to want to talk to a nutritionist. They can prescribe diets that are going to be much better for you if you do have kidney disease. Lowering your sodium intake, your potassium intake, all these things can be very beneficial to people who are at risk or who do have chronic kidney disease.
Yeah, so my name's Raymond Kumar. So good morning, classmates. And along with what Colt and Paul are saying, Paul's providing statistics and Colt is also providing some great information on renal disease. I want to step in and provide some resources that are within the San Joaquin County community for people who are experiencing renal disease, also known as kidney disease. So we have the Community Medical Center, and that's on 701 East Channel Street. And a little bit about Community Medical Center is that it's an organization that started as a volunteer effort in the 1960s because people in the San Joaquin community care about each other and they remain deeply rooted in the community and are dedicated to improving the health and quality of life for its members. So that's the Community Medical Center. And one of the great things about the Community Medical Center and why it's such a great resource is because every day the staff provides vital care to men, women, and children. And the best part is that it's regardless of ability to pay. So we all experience financial hardships. Not everybody has the same access to finances. So the Community Medical Center is able to provide vital care to men, women, and children regardless of pay. And then we have the San Joaquin County Human Services Agency, and it provides state and federally mandated public assistance and a variety of social services and programs for citizens of the San Joaquin County. And along with the California Work Opportunity and CalWorks foster care, one of the most important reasons why we added this in the presentation is because it offers Medi-Cal. So if you are experiencing kidney disease, the Human Services Agency can offer resources to connect you with Medi-Cal, and that's going to be able to provide some essential medical services. So I just thought those are great resources to tap in for members of the San Joaquin County community. Thank you very much. And then we just see some of the resources that I've mentioned in the previous slide.
So Healthy People's 2020 goals, they put out a variety of goals each year, but some of them for 2020 that are related to kidney disease would be increasing the proportion of adults with hypertension who meet the recommended guidelines. So keeping your blood pressure within a healthy range, ideally in the 120s. This is something that it can be controlled with hypertensive medications. Diet and exercise are also very important, but again, something that you need to talk to your doctor about. You also want to increase the proportion of adolescents who meet the current federal physical activity guidelines. So bringing back the diet and exercise portion of this is very important for a variety of things, but especially, in particular, chronic kidney disease. And then increasing smoking cessation attempts by adult smokers. Again, smoking can cause a variety of issues, and it's going to be best if you reduce the amount of smoking you can do or stop altogether. And then what we've learned, so one of the things I learned is learning about the different risk factors and ways to prevent kidney disease. And I hope that I laid out some of those for you today.
And also, I've learned that kidney disease is a global problem, and that it can affect anybody at any age. And it most commonly affects people who are 65 and older, and it affects women. So we should all just be careful.
Absolutely. And one of the things that I learned when I was researching some of the community resources in San Joaquin County is that not only for kidney failure, but for a variety of other medical issues or even psychosocial issues, there's a ton of resources that can cater to those who may not have the financial resources. So I was able to discover so many wonderful and valuable resources within San Joaquin County. So there is definitely a lot of hope out there for anybody suffering from renal disease. There's some great resources that can be tapped into.
Here are our sources. Thank you guys for listening.